Welcome to Preparing for Happier Holidays webinar. I would like to acknowledge the Lower Merion Health Advisory Council, as well as the Lower Merion Board of Commissioners for today's webinar. Let me start with introducing myself. I am Dr. Shawn Blue, and I am a clinical psychologist. I conduct individual, group, and couples psychotherapy. I also offer outreach programming and workshops related on wellness and mental health topics. I have almost 20 years of experience in university, hospital, and private practice. I have a passion for diversity work, and I have specialties in trauma, grief, interpersonal relating, and wellness. To give you an overview of what we'll talk about today, I would like to discuss the multiple factors that impact our experience during the holidays. We'll also leave you with some coping strategies to help you manage. As we start, I hope you will join in with me and do a mood check-in. When you hear the question, what does thinking and planning for the holidays bring up for you? What thoughts, feelings, emotions come up? Are you worried? Do you feel some anxiety? Do you feel some sadness, anger, resentment, grief, loss, or maybe even numbness? I'm hoping that through today's webinar, we'll talk about a lot of the symptoms and feelings that you're experiencing. And I hope that you will leave with an arsenal of tools of how to be able to manage yourself during the holidays. Let's start with stress. We know that this is going to be a brief webinar about some of the larger factors that play a part in what impacts us emotionally and physically. And we also know that in this time frame, we can't possibly explore all of the different issues that we will experience. But it is my goal for us to at least talk about a few of the major concerns that might impact us. And related to stress, there are so many layering pieces that often impact our experience of stress. Feelings of burnout, health and illness concerns, family dysfunction and stress, work demands, work schedules, unemployment, layoffs, and what feels like the ever-present concern around finances. So as you think about the webinar as we go through it today, how many of these stressors are ones that you experience on a daily basis, and that might impact you when we're going into this next holiday? There are also a lot of mental health conditions that we experience from a day-to-day basis, and again, that feel more powerful during the holidays. Symptoms like depression, feelings of anxiety, feeling overwhelmed, sleep problems, eating disorders and disordered eating, problems relating with others, even feelings of feeling unsafe. All of these are issues that we experience on a day-to-day basis and are exacerbated when we think of the holidays. Grief and loss is another large concern that people experience, especially during the holidays. Whether your loss has occurred at a different time of year or it has occurred around the holidays and represents a death anniversary, there can be feelings and symptoms related to grief and loss that make the holidays really hard to endure. Whether any of these multiple stressors and symptoms are relevant to you or might be relevant to family and friends, it's important for us to think about them and how they impact our holidays. Individuals are more and more being concerned with sleep problems, including insomnia. We know the impact that a lack of sleep has on daily functioning. and that is increased, especially around the holiday. And so thinking about ways that we can have a healthier sleep pattern is going to be important for us. Another stressor that happens especially during this time, is the winter season. Often we get concerns around or complaints around the longer days and darker days, which typically impacts individuals' mood and functioning. We have something called seasonal affective disorder, which has an impact in actually two different seasons. One is in the winter season, but another one also falls in the summer. But related to the winter season, this is related to the longer days and the darker days. And that really tends to have a negative impact on one's mood, where people typically feel more melancholy, more sad, have less energy during this time. And so it's important to figure out how those symptoms are impacted and how we can try to treat those during not only the winter season, but also the holiday season. So I think that the best strategy that you can employ is to make a plan. And I recommend that you hear this webinar and begin to think. We have a couple of weeks before our next holiday. And it's important now to start to reflect and create what will be your plan in terms of how to support yourself during the holiday. A lot of times individuals will come to treatment or come to webinars and say, you know what, those are really great ideas. And then they'll leave the webinar and then forget all about it. I say the best way that you can be successful over the holidays is to make the plan now and to have plans B, C, and D just in case plan A does not work out for you. And the next couple of slides will give you an overview of how you can create a plan for yourself. Let's start with ways to cope. There are multiple interventions and ways that you can think about in terms of coping strategies. A lot of them involve stress management techniques, self-soothing interventions. Some examples might be starting a mindfulness practice. Another one might be using a journal or deep breathing exercises. Another one might be exercise or yoga. You might have ones that are really relevant to you and unique to you that can be helpful in terms of supporting yourself. But there might also be some new strategies that you would like to employ. However, what I would suggest is that if you're going to start a new intervention, I would really recommend that you start now to implement the action steps to do so. For example, if you're going to start a mindfulness practice, I suggest that you download a mindfulness app, you bookmark a few mindfulness exercises that will be relevant so that when the holidays come, you'll already have it available and ready. If you don't do this work ahead of time, you're stuck in the holiday, and it's often harder in the moment to ramp up or to think about some of those ideas that if you prepare them now, they'll just be ready for you when you need them. Another big piece of preparation that I want you to think about are boundary settings. A lot of times individuals are uncomfortable with setting boundaries, but they are really necessary. So I want you to think about some of the opportunities for establishing a boundary during the holiday, whether that could be emotional boundaries, physical boundaries, safety boundaries, whatever those might be. And thinking about historically what have been the situations that you've been with and with this family or with these friends, that might create the opportunity for you to have some boundaries going forward. Now, I will say one of boundary setting can be hard, establishing the original boundary. But what also is difficult is the pushback that often happens when you do establish the boundary. So what I would recommend is that you are ready for both. Identify what those boundaries might be, whether it's for eating, whether it's taking your own meal, whether it's feeling safe in the house. Maybe it means not staying at the home, and if you're financially able, maybe it means getting a hotel or a rental. But thinking about what those boundaries are ahead of time. And then imagine what it would be like to verbalize those boundaries in a verbal and imagine what the pushback would be and how you might respond to that. And then just be prepared with your counter responses to whatever uh, pushback that you get. But just remember, boundary setting and maintaining the boundary after getting pushback from it can be difficult, but it doesn't mean that you should give up. It just means that you need to be more prepared with how you identify and maintain the boundary. Often during the holidays, there can be concerns around feelings that are hard to manage. And sometimes those feelings relate to being or feeling unsafe. And so I would like for you, whether that's for yourself or for family and friends, to be supportive around needing additional crisis and support. Definitely utilize the hotline calling or texting 988 or chatting 988lifeline.org for 24/7 crisis and support help. And again, utilizing this for yourself and or others is going to be really important. But just a reminder, if anyone is feeling completely unsafe in the moment and cannot confidently say that they can keep themselves safe, the best option is to take someone to the emergency room or to a crisis support center. Thinking about questions that I often get related to this topic, the first one typically revolves around navigating family dynamics. And here I would have you refer back to that plan that I started with. So plan ahead, reflect on how previous interactions have gone with family and friends, and then problem solve based off of that. Also, think about planning breaks. Maybe that means volunteering to go on an errand. Maybe you make up an errand that you need to go on just to get a break. Take a walk. If you're financially able to do so, maybe it means not staying at the home in order to give yourself some space. Also, utilize those self soothing techniques, journaling, deep breathing, mindfulness, and remember the boundary setting that we described. When we're talking about self soothing and when we're talking about stress management techniques, often we as individuals rely on some of those distracting techniques. So, being on social media, scrolling on our phones, playing video games, watching TV or numbing out in front of a TV, using alcohol and drugs. Although those activities in moderation are fine, and although sometimes we need distracting activities to balance out some of the affect regulation, the key is that you don't want to solely rely on and focus on distracting techniques as your only mode of support. So make sure that you have a combination of both, but definitely make sure you have some affect regulation skills in there. Another thing that kind of comes up in terms of preparing for the holidays is eating during the holidays. What I would suggest is prepping your meal ahead of time, asking for specific meals to be made from the person who is cooking, maybe even bringing your own meal. A lot of times, individuals want to challenge family and friends' unhealthy language around eating and disordered eating around the holidays. And I would say if that is your goal, then I would suggest again that you plan ahead and that you also think about some of the recommendations related to boundary setting. That you identify what you are going to say, but then you also keep in mind that you probably are going to get pushback. And that when you're trying to change people's minds, friends and family, it often doesn't happen in the first time. And so just keep that in mind especially if you are going to plan to challenge something, especially something that's going to be a difficult topic for you. So think about what your response might be if you get pushback related to what your challenge is. The other option might be maybe the holidays isn't a good time to challenge it, especially if you're overwhelmed with other concerns, and maybe considering a different time to challenge that particular issue. I also would recommend having an accountability partner or support partner. This can be helpful during the holidays. You can identify a trusted friend or relative. Maybe you can create a code word that you can utilize if needed, and if you need to rely back on a support plan that you two have created. So the idea is to do this ahead of time, identify the person, reach out to them, say, the holidays are coming up. Would you be my accountability partner? Here is our code word. If I say it, that means I need you to take me away so that we can go take a walk or run an errand or just get me out of a situation. You also might want to send your accountability partner your plan so that they can also be a support to you and reminding you to use the interventions on your plan. And then I'll also have you think about grief and loss and how you can support yourself around those symptoms. Think about changing the tradition of the holiday, for example. This could be just for this year, or you might find that this new tradition works for ongoing years. There might be some pressure to keep it the same way, but that doesn't mean that it has to be that way. So think about the opportunity to potentially change up the holiday, especially in the light of loss and grief. Maybe think about ordering in, designating others to help cook or help organize other parts of the day. Maybe thinking about utilizing activities or games to kind of structure the day. What I will leave you with, though, is to try and not feel the pressure of others' needs, but really tap into what is meaningful to you and grieve in a way that is meaningful to you as well. A lot of times it's really hard to work against others' expectations and needs of us. But when it comes especially to grief and loss, I really recommend to you that you have your symptoms and you process your symptoms in the way that really makes sense to you and is unique to you. I hope for those who have a therapist that you will utilize this webinar as a spark to recommend to your therapist that you create a plan together. Your therapist and you can really utilize interventions that are unique to you and unique to your problems, and really can create an individualized plan for you. I will also say, if you aren't in therapy and you do experience some of the concerns that we talked about today, that you might take advantage of the benefits and values of therapy and what they can do in helping you manage. But this is a perfect time to get started, to either seek out treatment or to utilize the treatment that you have in order to make a plan that's good for you and to help you be supported over the holidays. And if you need any consultation or need to get in touch with me, I am leaving my contact information here on the slide, and you can contact me from phone, website, and email. The key is to get the help that you need. I want to end by just saying thank you for attending today. Thank you for participating. I hope that you will take the interventions and the ideas described today and recommended today in creating a plan that is going to be supportive to you over the holidays. And of course, I am wishing you a very loving and grateful and thankful and beautiful holiday this year and every year. Thank you.